Your hips are stiff, and you notice it's getting even worse. Moving is getting difficult, and it hurts. I'm Roland Liebscher Bracht, and I'm going to show you 2 exercises done while sitting that you could do during your day to alleviate the situation, and I'm going to show you 2 spots you can press on. I'm going to explain the exercises and the backstory to them, and Sina is going to demonstrate them. So you at home sit on your chair and try to do the following. Simply try to cross your legs right over left, very simple. People are warned not to do that, to sit like this. I completely disagree. There's no reason not to do that. Simply change positions now and then. If you could do that, try to place your leg, your calf, horizontally on the other leg, like this. Sina can do it. If you cannot, which is often the case, then there is a way to slowly get to that point. With the help of a stretching strap or a belt or a towel if you have one nearby. And then you put your foot down again, set it across the other one, and take the strap and slip your foot into it, and carefully pull your foot up and feel how far you can go, maybe just to that point. If that's the case, do the exercise in this position. Hold your foot in that position, arch your lower back, and then with your lower back arched, you slowly move your upper body forward and down, and then you could feel it. Now, we're working on the right side now. If your problem is on your left side, then you work on your left side. You'll usually feel it in your buttocks, usually exactly where the pain is, where you're sensitive. You could feel that stretch, and that means you're doing it right. And then, a couple of days or weeks later, you could pull up your foot a little more, and a bit more. Pull your foot up just as much as you are able to do. There's something else you could do to make things easier. Let's take away the strap. Now stretch out your left leg and place your right foot across your left one. And now you have an ascending rail on your left leg that allows you to work your way up bit by bit. Sometimes you could lock your left knee so that you could slide your right knee above your left one and start the exercise like this. And then you start bending your left knee more and more. Bend it more and more until your right calf is in the horizontal position. Now you have your right calf in a horizontal position, and that also gives you this slow development. Try out what suits you best. The most important thing is, however, that at some point you arrive at that position, this position here. And then it could be that your knee is in this position, and it's not down as it should be. Then place your right elbow on it, on your right knee, and push down every time you do the exercise. Not as fast as Sina here, because if your muscles are still too short here, that would be hard to do. You have to work on that very slowly. Well, let's focus on the position of your upper body now. Your lower back needs to be arched. Why is that? So that the stretch doesn't go into your upper body, but into the axis of your hip joint, which is about here. That means from here on up, your back needs to be straight. Only in the lower back section does your upper body go forward. There's a good trick to control that. Focus on your belly button. And focus on not leaning your upper body forward, but that your belly button is moving forward. Because if your belly button moves forward, you make sure that your lower back stays arched. Careful, you're bending your upper body. That's better. Only your lower back. Your belly button moves forward, not up there, only your lower back, and at some point you have to stop. But leaning your upper body forward even more would not bring any relief to your hip joint. And that's why this fine-tuning is so important. So that was it for the basic exercise. There are also other things that could help you to bring a stretch to those areas that pester you the most where everything is too tight. Mostly, after getting this basic stretch going, if you now lean slightly to the left when tilting forward, away from the leg you're stretching, slightly to the left, then you have a more pronounced stretch in your left buttocks. And remember, a strong stretch is exactly what makes this exercise so valuable. If you do an exercise that comes easy to you right from the start, it won't be able to develop an effect. So the more it stretches, but not too much, just barely doable, a positive kind of pain, the better it is, and everything is fine. If both of your hip joints are a far cry from feeling light and untroubled, then do this exercise once for your right hip and then for your left hip, but with each passing day you'll notice how much is happening there. And now, let's move on to the second exercise. Here, you just stay on your chair, just like Sina here. And now you do the following. Scoot to the edge of your seat. Now, you at home have to figure that out for your individual chair situation. Let me show you what this exercise is all about. You take your left foot and slide it back under the chair as far back as possible and slide forward, but make sure not to slip off. This is important, not too close to the edge. And now, tuck your belly button in and go back with your upper body. And just as your belly button is moving backwards, not up there, but down here and backwards, we're going to do the same exercise, but in reverse. Earlier, we stretched open our buttocks, and now we stretch our groin open. If both of these areas are stretched open, 80 to 90% of your problems normally should improve. Hold on to the chair, hold on tight, control your belly button, and pull it backwards so that your pelvis also tilts backwards. Could be that you develop a stretch right here, but important, your leg should be bent here because that involves another muscle into the stretch that, in addition to the hip flexor, has a lot to do with the hip. And if both of these muscles are stretched open, that will free up your hip in most cases. Work your way backwards for 2 to 2.5 minutes, but everything hinges on your pelvis going backwards. So now we're going to show you how to not do this the wrong way. Now, bend backwards, Sina, in your lumbar spine. And now you can see Sina's upper body moving backwards. Her pelvis, however, is not following that move as it should. And that does away with the most important stretch. So upright again, please, Sina. Now we focus on your belly button. It wants to go back. And now your stomach moves backwards with your pelvis. Maybe you won't be able to do it right the first time because you still lack that kind of control over your body. But after 2 to 3 days of exercise, you'll be able to do it. And then a stretch starts running along your thigh, into the groin, maybe even into your back. And that's great, since that frees up your hip. So now we're going to show you some more tricks. I'm going to show you how Sina can press herself. Very conveniently, you could do this while sitting on your chair. You sit down, relax. It's good to demonstrate here with Sina because her pants are so tight, because it's important to tell where your crotch ends and your upper thigh begins. You draw a straight line from your crotch to your thigh. From your crotch, draw a straight line into this direction, in this direction, and then halfway from this side here to the top, diagonally from here, you place your thumb on that spot. This is the point where the hip flexor is attached. And if you press on that spot, it relaxes you immediately. Now there's a trick to find that spot. You take your left hand and place it on the inner side of your right knee. Then you put your right thumb on that spot that you just found. And then you push your right knee to the left. And you'll feel how the adductors tense up. Then move your right thumb to the right to a place where there's less tension. There's kind of a groove. You found it? Go in there, in this direction, using our presser tool or a wine cork or something else from a bottle maybe. No, you take a champagne bottle. It has a cork on it that looks like a mushroom, and you take it and place it and try to find the spot. Or another household item. Sina is going to use the tool and places it on the spot and starts looking. Not too deep, though, since there is a lot of adductor muscle mass. You have to be slightly higher, since your bone is rather close to the surface. Push here and you could feel it. Look for it. You're a bit too deep, a bit higher. Look, let me help you. Could be here. Ah, look at her face. You see? Now you can tell she found it. Ouch, it hurts. And you have to love that pain. It takes some practice, more than with other exercises, but it's worth it. And after you do that 5 to 10 times, you'll have no problem finding that spot. And then you could use it to get some relief now and then during your day. And stay on that point. It develops a kind of pain sensitivity. Stay on it and wait for the pain to subside. It wears off since these points, these receptors, switch something on in your brain to relax the hip flexor. And just as the hip flexor relaxes, the pressure goes down. It takes some time, 1, 2, 3 minutes. That's why we use the tool or some other household item you might use. With your fingers, well, it's harder to hold if you're not used to it. And just working on this point relieves your hip markedly. It feels lighter. And there's another point, and for this, we, personally, take the cone with the flat top. You can also take a dog's toy, a ball, for example, or something that can have the same effect. Now, what you're going to do with it, you're going to sit on it. Slide it underneath, and try to find spots that are sensitive. Where does it hurt? Find all the spots. And you find any spots, then you stay on it. Oh, you could type, or you could have some dinner, whatever you want to do. And everything will be dialed down and relaxed. Give it a try, you'll be enthusiastic. And we have an educational video telling you how hip pain gets started. Please click here to see it and get all the explanations. And Sina and I say goodbye.